The following is a summary of the health plan for the employees of diversified contractors for year 2018.
My name is Barry Hamrick. I'm always here to help. You can reach me on my cell phone 205-222-9440, or you can always reach out to me on my email rbhinsurance@gmail.com. Your new health plan works a little bit different than plans have in the past, but we think you're going to like it. There's really two parts to the program, and we're going to talk about them in detail. The primary health plan is through United Healthcare All Savers, which is a special program that only certain groups qualify for. You'll also have a second card, a gap plan card, through a company called SIS. Claims are first filed and processed with the primary plan. The primary plan will provide you and the healthcare provider with an explanation of benefits, or EOB. The EOB shows them how much of the claim is your responsibility to pay. The claim is then filed by your healthcare provider with your gap plan. The gap plan pays your responsibility for major medical claims, up to $2,500 for outpatient claims and up to $5,000 for inpatient hospital stays. This should eliminate or dramatically reduce your out-of-pocket costs for all your major medical expenses. Here is a timeline on exactly how this works. Every time you use your health plan, other than at the pharmacy, give them both of your insurance cards. Step 1 is your healthcare provider will file the claim with your primary health plan, United Healthcare All Savers. Step 2, UHC All Savers processes the claim. They'll confirm it's a covered benefit, they apply the discount for going to a participating provider, and they'll pay the claim according to the benefit schedule. The healthcare provider and you will receive a copy of the explanation of benefits. Step 3, the healthcare provider sends the original claim along with a copy of that EOB to the gap plan. The gap plan will pay your qualified out-of-pocket expenses up to $2,500 per year for outpatient and up to $5,000 per year for inpatient. This is paid directly to the healthcare provider, and there is nothing that you need to file. Here is a brief summary of your health plan alongside your new gap plan benefit. You will note you have a $30 office visit copay for a regular doctor or a specialist. The gap plan does not pay a benefit for office visit copays, so you will pay that amount at the time of your service. The health plan itself has a $3,000 major medical deductible and a $6,000 out-of-pocket maximum. You will note no one person in the family can spend more than $6,000, but there's two maximums per family. The gap plan is going to pay up to $7,500 of your out-of-pocket expenses for you. That means most of you will have zero out-of-pocket. The section in pink shows your inpatient hospital benefit. You have a $3,000 deductible, then the health plan covers everything 100%. Your gap plan pays up to $5,000 for inpatient hospital stays, so your out-of-pocket for a hospital stay is probably zero. The section in blue shows your major medical outpatient expenses. You have a $300 copayment for the emergency room visit, and everything else will apply towards your annual $3,000 deductible, then covered 100%. Your gap plan is going to give you $2,500 to spend towards those benefits. So once again, most of you will not exceed that gap plan benefit. Your gap plan does not pay a benefit for prescriptions. More on that later in this presentation. Hopefully by now you're seeing the benefit of this new health plan design. However, as a consumer, there are a few things that you need to watch out for. Number 1, be sure to give both of your new cards to your healthcare providers every time you use it. Also, open your mail and monitor the claims process. You will get a paper trail showing you how your claims have processed. If you do get an invoice in the mail with a balance due, take note if the claim has been filed with your gap plan. If you don't see mention of your gap plan, the healthcare provider may have neglected to file it with your gap plan. Have your gap plan card handy and call the number on the invoice to remind them to file it with your gap plan. If you have had several claims or a large claim, it is possible that you have exhausted your gap plan benefit. You can always call the 1-800 number on your card to confirm if that is the case. If you're still having problems, you can always reach out to me. Call Barry at 205 222-9440. I'm always glad to help. I want to be sure you get the most out of your health plan, so here are a few important tips that I have learned over the years. Number one, be sure to always utilize a participating provider with United Healthcare every time you use the plan. The network is very large and most providers are participating, but you should always confirm that before your visit. Also, it's important to know that your plan through United Healthcare All Savers files claims to a different address than the standard United Healthcare address, so be sure to point that out to your healthcare providers when you give them your new cards. Also, if your doctor refers you to another doctor or facility, that is not a free pass to go out of network. You still must confirm that your doctor or facility is a participating provider with United Healthcare. By the way, your plan does not require that you go to a primary care physician before you go elsewhere. It's important to know how to avoid any drama with this plan, or any health plan for that matter. If you have a procedure scheduled, always call to confirm it has been approved several days prior to your appointment. In some cases, you may want to wait until it is approved before you schedule that procedure. Earlier, I mentioned I would come back to your prescription benefits and we would talk more about how to get the most for your money. Your new health plan has a 4-tiered prescription benefit structure. Most prescriptions will fall into the Tier 1 category and you will pay no more than $15, usually less. There's also a Tier 2 for $35, Tier 3 $75, and on rare occasion a Tier 4 for $250. It's important to know about this health plan and any health plan that you have in the future. If you are prescribed a medication that falls into the Tier 2, 3, or 4 categories, there is very likely a way to get that exact same medication from the exact same resource for a lower cost. So be sure to learn more about the following tools. GoodRx.com is a great way to find out if there are cheaper ways to get the same medication from the same resource. BlinkHealth.com is a great way to get a lower cost on generic drugs. So even some drugs that fall into that Tier 1 category, you may be able to buy for less through BlinkHealth.com. NeedyMeds.com is a great way to find copay cards and also find programs to help you purchase your medications for cheap or free. Most every drug that falls into the Tier 2, 3, or 4 category has something called a copay card or savings card available from the pharmaceutical manufacturer to get your costs down. In many cases, you can buy the medication for $5 or $10 and the copay card will waive the rest. If you would like to learn more about that, or before you get a prescription in the Tier 2, 3, or 4 category filled, you may want to reach out to me at 205-222-9440 or email me and I will help you find your copay card or your savings card. If you are taking a medication that costs more than $15, there is probably a copay card or a discount card made available from the pharmaceutical manufacturer. These are easy to locate and easy to use. Just Google the name of the medication followed by copay card or savings card. This can save you a lot of money and is probably the most important thing I can tell you today to reduce your healthcare spending. As mentioned several times in this presentation, if you have any questions or need any help at all, you can always reach out to me. My name is Barry Hamrick. You can reach me at 205-222-9440 or at rbhinsurance@gmail.com.